Yep.
Okay, great. So, all of this is really, we can chalk this all up to something that we call the collapse of compassion, right? So this comes from this comes from a study that was done in 2007 by a couple of researchers in Pennsylvania. And basically what they did was this. They got a bunch of participants into the experiment under fake pretenses. They told them they had a survey for them to fill out, and that they were going to get $5, right? So they had people fill out the survey, the content of which is not important, because the real part of the experiment was what happened afterwards. So they hand them the $5 along with an envelope and a letter from Save the Children, right? And it basically is a letter that invites them to contribute money to combat child hunger. Right now, 1/3 of the participants, and then the envelope is for them to actually put the money in and donate it in that moment. So the 1/3 of the recipients got a letter that basically talked about a personal story, right? And the personal story of a child who was actually impacted by the issue of hunger, talking about their life, right? They called that identifiable life, right? The second group of folks got a letter that would describe what they call here in this study statistical life, right? So it talked a lot about the magnitude of the problem, how many people are being affected by child hunger every day. And then the third group of people got a letter that gave a personal story, but then also included some context of statistics about the systemic effects and, again, the number of people who were affected. One of the kind of more surprising results of this, right, is that it turns out that people gave more money on average to the appeal that just told a personal story, included no facts, no statistics. And if you actually include that personal story, but also include statistics, you brought down the amount of money that they were on. The researchers suggest that this shows that compassion tends to collapse the bigger the problem seems, right? So when we talk about large numbers of people, it is much harder for us as humans to be compassionate than when we talk about a single person, a single life. And again, this is why that personal connection is so, so critical to all forms of organizing. I always think that survey is pretty that study is pretty depressing, right? Because it's, you can have all the facts on your side.
It is depressing.
It is, right? Thanks, Lucy. So that's one of the reasons that we decided that we need two things, right? We know we need to make personal connections with people, hear personal stories from people, and we also need to just increase the number of people that we're reaching, right? And build our movement. And so that means reaching people who are like outside of the bubble of folks who are traditionally concerned with Medicare for all. So we decided on a survey model for this, and we based it on a couple of different kind of things. One was observations that came out of a lot of deep canvassing, which is a kind of canvassing method that folks have been working on in the past decade or so. Really started by some folks prompted by some folks in California who were fighting Proposition 8 and started this deep canvassing project where they actually went around and connected one-on-one with voters. And instead of just messaging at them, right, they had deep conversations with voters. They heard their opinions and they talked at a personal level. That kind of model also worked really well for a couple of different statewide statewide Medicare for All organizations that have been working on this. For example, the Campaign for New York Health did a very successful survey campaign while they were really good about using surveys in order to bring people into the movement. So why are surveys great? The first thing is that they're a structured form of listening, and listening is the thing that we do not do enough in our movement, right? Basically, when you're doing the survey, you are devoting all of your time and attention, not to telling someone what you think, but to hearing what they think. And that is where the best conversations come from in organizing and in life, of course. The second reason is that we know that our movement should be led by people who are most impacted, right, by all the problems in our healthcare system. So surveys help us to identify those folks and get to know them, right? So we can use surveys to reach out to people and find out more about them and start to develop a relationship. Survey responses are the beginning of a healthcare stories, which is something that's really important to us, right? If we see that statistics are not persuading people, we know that those individual personal stories, right, are going to be the way that we actually reach people on this issue. And from the survey responses, we've been able to identify a number of really good stories that folks have, kind of come up with. And again, it's from talking to friends, neighbors, people in their communities. Um, and then finally, we can be intentional about who we survey. And that's really important because one of the things that you'll notice about the people who are already most enthusiastic about Medicare for All is that, a lot of us are whiter and older. And we know that the people who are disproportionately impacted by the social security, by the healthcare crisis, right, are people of color, low income folks. A lot of young people are impacted. It's a broad swath of people, and we want to make sure that we are reaching out to them. So if you look around in your community and you say, okay, all the people around who are fighting for Medicare for All here, we don't have any youth in the group. You could actually go to a college campus, for example, and interview people and meet some folks that way. If you were interested in saying, a lot of our leaders here are able-bodied, right? It would be really cool to reach out to a local disability group and talk to folks there so that we can get those folks more represented in our movement. So that's why the survey, that's how the survey ties into this kind of overall strategy of really building our narratives and building our stories. We're asking people to really start, right, from the people who are closest to them. And honestly, those are the people who are sometimes least likely to talk to about healthcare, right? When's the last time that you sat down with your sibling or your cousin and actually had a conversation about healthcare? So we ask people to start by looking for folks in their inner circle who would be interested in taking the survey. We then move through to say, think about your networks, right? So think about people you work with, people you go to school with, the parents of the kids at your kids' school, right? Faith groups like your Unitarian Universalist congregation, of course. And then, sports, clubs, organizations, people you have relationships with, but haven't had those conversations with yet. And then finally, strangers, right? So some people are doing door-to-door canvases where they actually knock on doors and ask people to do the survey. Some people have been phone banking. And then folks have also had some success on tabling at events, right? You go to your local farmer's market, or over the summer, a group went out to their local 4th of July parade and set up a little table and had people sign up. So that's, kind of the question of who we are interviewing. And then I just want to kind of just briefly, hold on one second. Let me rearrange my windows here for a second. So are you looking at a page that says Census Interview?
Yes.
That's fantastic. All right, great. So I just wanted to kind of show you what the census is, right? It's a basic interview. It takes about 15 to 20 minutes. And it is just basically about issues people might have accessing healthcare, right? And it starts really broadly, asking people about their health. It goes on to talk about insurance, get people's, what people's insurance companies were, talk about the longest time that they've gone without insurance. We talk about healthcare costs, which of course is its own, issue, skipping and delaying care, throughout, though, I just want to note that we're like asking throughout, can you tell us more about what happened? How did that impact you, right? And so what we're really looking for here are those open-ended answers, right? The questions that open-ended answers to the questions that really get people talking about what happened to them and really get people into their feelings and out of their head. And so, again, we ask them more information about basic healthcare access, discrimination when it comes to healthcare. And we move on, and this is the part where we start to provide some political context, but we really went to a lot of trouble when we composed this survey to try and avoid political jargon and healthcare jargon. And so we wanted to make it the kind of thing where you could actually have this conversation with someone who maybe has different political beliefs than you. So the way that we ask the question to folks, once you've had this conversation, shared some, right? Do you think we should make sure that everyone in the US can get the healthcare they need? Just as simple as that. And I'll tell you, I live in South Texas, and I know that a lot of my neighbors, if I said universal single payer healthcare, they would be like, you communist, right? But when I tell them, when I ask them that question, don't you think that we should make sure everyone in the US can get healthcare? Of course, the answer is yes, right? We're tapping into people's basic humanity. And then we talk to people about what they think about the idea of a healthcare system where healthcare is a public good. And then this question, which has been really fascinating, if you could change anything about our healthcare system, what would it be? And we've gotten so many amazing responses from people who had so many ideas really about ways that we could improve the healthcare system, from taking away the profit motive, right, which is something that I'm sure we've all thought about,
Yes.
all the way down to free tuition at medical school, so that doctors aren't already starting out their professional careers already mired in debt, knowing that they have to make as much money as possible to get out of that debt. Ask for additional comments. We do some demographic information. Again, this is not a peer-reviewed study. So, we're really thinking a lot less about the data, right? And a lot more about the stories that are emerging, the relationship, the actual interaction of talking to someone. And I always say, I think people carry these healthcare stories around in their heart, and it just burns a hole in their chest until someone asks about them, right? People just get ashamed. They feel like maybe they've caused their healthcare problems. Maybe they've made poor choices in life that have led them to the point where they can't afford healthcare. And really asking people, or just don't think it's polite to bring up, right? And so asking people about that is this amazing gateway to really find out, what's influencing the hearts and minds of your neighbors. And just give a couple of active listening tips to folks when we're teaching them how to do the census. Just, really getting folks to repeat and verify what you heard, right? Repeating after someone is actually one of the most powerful ways of reinforcing their sense of personhood and being listened to. Don't get distracted. I always say, don't write the punchline before you heard the joke, actually wait and listen to what the person says before you decide what you're going to say back. Don't interrupt, and obviously make some eye contact if you can. And when we ask people to listen to these stories, thank you, Lucy, for chuckling. I appreciate that. When we ask people to listen to these stories, we're asking them to listen for two things. One is stories themselves, right? Compelling stories, right? And a compelling story could include any of these things, right? It could be emotionally resonant, right? If it touches your heart, probably touches someone else's too. It could offer a kind of unusual perspective, right? One of my favorite folks to hear talk about healthcare justice is a guy named Wendell Potter. Some of you might know him or have heard of him, but he is a former healthcare executive, and he's also a native of Tennessee. So he talks a lot about being a healthcare executive, living in the world of healthcare for profit, and then going home to Tennessee and watching people sign up for an outdoor clinic. And that, it's touching partially because it's an unusual perspective. We don't usually get to hear about it from the perspective of someone who's both who's an executive in the company and also interest and also has like these kind of concerns. Or it could be a story that just like really just succinctly illustrates a particular kind of injustice, right? I talk all the time to folks who are immigrants. I always think about my friend's father, who is undocumented and has worked in factories all of his life. And his story just illustrates the way in which immigrants put into the healthcare systems in this country, but are unable to collect at the end of their lives when they need healthcare. So again, we want stories that really kind of point to the particular kinds of injustice that we're interested in exposing. And then the second thing that we listen to when we listen to people's stories is we want to listen for leaders, right? So you want to listen to people who are fired up, either in a positive or a negative way, right? Anger is a kind of being fired up. So if someone's saying, man, these questions are making me think, just about how terrible this system is, and that's great. If someone's like, hey, this is a really great idea to talk to people about this, that's great too. One thing you want to listen for, and this is something that always just comes up in the subtext, is you want to listen to people who are connected to others in their community or their workplace. And you can hear that when they tell stories because they always involve other people. This is the person who you talk to who's going to point out everyone on the street that you need to speak to next, right? Or the person who you're going to talk to who's going to tell you about 7 different people who they work with who have had healthcare issues as well, right? Or it seems to be, the one who's the hub of the network for their entire family. Those folks are great organizers. They're natural organizers, and we want to really engage them in our movement. And then finally, good communication skills. You do not have to have good communication skills to be a leader, but it really, really helps. And so, when you are talking to someone, if someone seems especially articulate in talking about healthcare systems or talking about their experiences, you want to note that and pay attention. And in fact, part of the healthcare census survey form, once you get done asking questions of the person that you're interviewing, is we ask you as the interviewer to make an assessment, like, is this person someone we should follow up with right away? Should we prioritize that? So that's a kind of overview of the healthcare census, right? Which is one project, again, that we're doing to really try and build these kind of personal relationships that we know we really need for our movement. And we're inviting groups all over the country to participate. There are folks in Colorado at the Colorado Foundation for Universal Healthcare who are going around and doing surveys in Colorado, trying to build up support for a ballot question they're working on there. And we see folks in other states as well who are doing this, and really just trying to make it work and make sure that we're using this to build our movement. The other thing that I just wanted to tell you about before I wrap up, and then I promise I will wrap up, is that we are launching, speaking of, kind of personal connections and really interacting with people on an intimate level. We are also hosting a series of Telling Your Healthcare Story trainings. We have dates that are available. Dates that are available through December. And so if folks have a powerful healthcare story and are interested in learning the best way to share it powerfully, that's something that we can help you with. And that's part of our kind of larger goal, which is to, develop a national network of spokespeople, right? Who can, talk to the media, to legislators, to the public at large, about why we really need Medicare for all in a personal and moral way. And you can find all of this information, of course, on our website, which is www.healthcare-now.org. So with that, I will stop sharing my screen. And I'm happy to answer questions about anything except the video that interrupted the first part of this talk. So I think the best way to get involved is that we have a form available on our website where you can sign up, or folks are, of course, welcome to contact me personally. I'm Gillian at healthcare-now.org. Gillian with a G.
Yeah.
I'm going to type it in there.
You got it.
Oh, thank you. And honestly, I really just want to say that I appreciate all of you, and I think I've heard you all advocate on this issue at different points, and I really respect all the humanity that y'all bring as leaders in this movement. I think that's really awesome. All right,
thanks,
folks.
Gillian.
Thank you so much. Stay safe and stay dangerous.
Have a good evening.
Right. Thanks a lot, Julian.